Hey, everybody. My name is Dr. Michael Wald, the Blood Detective, and today's podcast is entitled Medical Mistakes and How to Avoid Them. So, what you should know is that I've had over 33 years in the area of holistic health, starting off as a chiropractor, getting my master's degree in nutrition, my PhD degree in holistic philosophy. I'm a dietitian. I provide acupuncture to my clients. I do life coaching. I even went to medical school. I graduated, earned my MD diploma, but I do not have an active medical license. Through all of that experience and doing my medical rotations in medical school, I witnessed a huge amount of medical errors, and I'm going to share some of them with you. So some of these medical errors that I'll discuss now, I've seen in a hospital-based setting, and others are in like private practice type settings. So this will be very practical for you. So let me know your thoughts too once you listen to this podcast. Now keep in mind that this information is not meant as a substitute for sound medical or health advice. It's meant for your education, so please use this information wisely. So let's get into several of these problems in medicine. The first one is, which is a medical mistake, obviously, is misdiagnosis. And hundreds of thousands of people every year are misdiagnosed. In fact, based on another podcast I've done, the count might actually be as high as about 12 million misdiagnoses every year in the United States, which means that 100% of those 12 million misdiagnostic cases are wrong. So this is a huge problem, and almost everyone that I meet with, and I have met with over my many years, many decades of doing holistic healthcare, have reported innumerable medical errors. So the first one is misdiagnosis. So for example, a heart attack being misdiagnosed as acid reflux or heartburn, particularly in women, since women are treated a little differently, even by female physicians, studies have shown. So the solution to that particular misdiagnosis is you want to use comprehensive diagnostics and second opinions. So if you feel that something more is going wrong with you, see another doctor and let them know, I think something more is going wrong with me. I think the last doctor got it wrong. I don't think this is an anxiety attack. I don't think this is acid reflux. I think it's cardiovascular. And then if they give you pushback, go to another doctor. Next, medication errors. This means a lot on a number of levels. So for example, a patient receives the wrong dose, and in this case, the wrong insulin dose, causing hypoglycemia, low blood sugar, or we could be talking about the wrong dose of practically any medication. And you have to realize something, that the medication doses that doctors are used to prescribing are the ones handed down to them from the manufacturers of the drugs themselves. So that just makes me suspicious that the recommended doses are probably much higher than they need to be. You know, I'll give you an analogy. I just learned this yesterday about laundry detergent. You know, when I do my laundry, I use a big cup of it, which is on the top of the laundry detergent. And I read, based on some study that was done, that we only need about 2 tablespoons per full load of laundry. And if we use that, we would clean our clothes just fine. And of course, that laundry detergent would last much, much more or longer. And the same thing goes here too. For example, I've had clients that are on, let's say, statin medications for the cholesterol, and the cholesterol is well controlled on the statin, but they were concerned about side effects, and there are many with statins. So we experimented at the time and had them they were on 40 milligrams of that statin medication every day. We got them down to 10 milligrams every other day with the same control. So if you use the minimum amount of the medication that gives you the optimal effect, you're going to reduce your risk of side effects, and you're going to get the result of the medication if that's the way you want to go. So, you know, always question your doctor about the medication doses, because they almost will never do that with you. They will just write the regular dose that is on that bottle or recommended, but it's usually not enough. Now, sometimes it is enough and it is the right dose, so you must question. And then if they say to you something like, well, I don't really know if a lower amount of this medication is going to work for you, say, well, can we experiment with it? And they'll say, at least in their minds, that, well, if this condition is something that's not acute, so yeah, we can do a little experimentation here. And if they say no, you want to ask why. Okay? Next, surgical errors. We've all heard about these nightmares. For example, the doctor performed surgery on the wrong knee, or a wrong part of the intestinal tract, for example. So In a hospital setting, we want to have the practitioners enforce surgical checklists and what they call timeouts and site marking protocols, where they're actually marking it with a team present to know the area. So you want to emphasize the area to your doctor and say, we're operating on the left knee, right, doc? Or we're operating on the right wrist, right, doctor? And that is going to be something. What about delayed diagnoses? So, for example, a cancer diagnosis is missed until it's in late stages. Why is it that so many people, and I don't mean to just focus on cancer, but let's just focus there for a second. The first indication that they have cancer is that it's spread everywhere. Why is it that, at least according to the news, that former President Biden has advanced metastatic prostate cancer? I mean, I would have thought that his doctors, the doctors that were the doctors of the President of the United States, would have practiced better preventative health care and screenings, because if they had, they might have seen this cancer years, if not a minimum of months before he gets this surprise diagnosis. So these doctors really, I think, they are owed some amount of responsibility for his late diagnosis. So that would mean you want to encourage early and preventative testing and act promptly on various symptoms and signs and abnormal findings. I see too often a client will come in with labs done from another doctor, they'll show me the lab work, and I'll see all these abnormalities, and I'll say, has your doctor discussed this with you? No. And then I'll speak to the doctor, and they'll say, well, I didn't think it was so bad. I'm like, doc, why would you want to wait until the condition is advanced when every condition is easier to manage when it's at the beginning? I mean, this is just common sense. Apparently, it's not common sense. So you need to take a proactive position yourself. You can insist on having certain appointments on a regular basis. I would say every 6 months. You have some labs checked. You get a physical examination, by people who are preventatively oriented medically. So, for example, when I want to prevent diseases in someone's body, I will do laboratory testing in all areas of medicine practically at the same time. Regular medicine is not set up to do that. In fact, if you ask your primary doctor or your family practitioner to do testing outside of their specialty, they will give you some major kickback. And they probably should, because they don't understand the other testing well enough. They're admitting it. Otherwise, they would do it. And of course, if you are trained in these areas, and I did write a 500-page textbook on the nutritional and medical interpretation of laboratory work, you will find that most docs do not put it all together in a holistic fashion. They are trained in disease care. We do not have a healthcare system. We have a disease care system, but a healthcare system has early prevention and has mindfulness of using natural things such as sleep and reduction of stress and food and nutritional supplements, for example, first. And if those things don't work, then you try medications. Okay. What about failure to communicate as another medical error? So a critical lab result, for example, is not communicated to the treating physician, the staff, or even the client. In other words, you get blood work done. The person comes to see me and I'll say, okay, have you had any lab work done in the last year? They'll say, oh yeah, I just had some laboratory work done. And I say, well, do you have a copy? Well, no, but I think it's all normal. They will always say this. Well, I think it's all normal because they didn't contact me. I'm like, really? So you think medicine is that good? I won't say this to them, but I don't think medicine is that good that just because you don't get a call back, everything is fine. I would say 9 out of 10 times in my experience, the labs were abnormal. And sometimes the laboratory results, another error in medicine, is relayed to you, let's say, by a nurse or someone else. Now, I have full respect for nurses, for example, but they are not properly trained, unless they're nurse practitioners, to interpret detailed laboratory tests. So we want the doctor to communicate this to the patient every time, particularly if there are actual abnormalities. And what about hospital-acquired infections? So there is an infection known as MRSA, methicillin-resistant Staphylococcus aureus, post-surgery. It is a deadly infection that is running rampant in hospitals. And when I did my hospital rotations in medical school, I remember a person having this infection, and we went into this room, which was a special room, which was supposed to be protected, and I and the chief doctor there wore masks and headgear. We covered our hair, we put booties on our feet, and then we walk in, and the doctor has the patient's chart, and they put it on the desk or the side side table where the patient is, when that could easily be colonized, that side table, with MRSA or other infections like C. diff. And then they take that chart, they walk outside, they give it to the nurse at the front desk, or they put it on the counter, and they're spreading diseases all around. So all I can say is you might want to practice extreme hand hygiene when you enter a hospital, before you leave that hospital, possibly even wearing gloves. That would be much better, and wearing a face mask, that sort of thing, because hospitals are breeding grounds for infections, and studies have shown that the doctors and staff in hospitals, they are colonized with all sorts of bad bugs. And by colonization, I mean they might have the bad bugs under their fingernails, then they bring it out into the community. It's a mess. And it's killing hundreds of thousands of people every year between MRSA infections that are brought into the community outside of hospitals, and C. diff infections, another deadly infection. And what about improper use of medical devices? So a catheter, for example, is inserted improperly in the hospital. So the person gets puncture wounds, they get secondary infections. And we know that even when performed properly, catheters in hospital-based settings or at home, they are a potential and extreme site of infection. So you need to know this so you can watch yourself or watch anyone else that you might know that has a catheter, for example, or any other medical device that punctures into their body for any periods of time. And in a hospital setting, we want to provide staff training and ensure proper device protocol adherence. Sometimes they don't do it because if they did, they would prevent a lot more of these infections. And people die of these infections when they otherwise wouldn't have had to die. So we have to be proactive in the hospital-based setting, and that's just that. But you need to know about these things yourself so you can be a conduit for your own voice, so to speak. And then there's patient discharge failures. Now, not just discharging from hospitals, because if we've been in hospital settings that we have, let's say, a medical procedure or surgery, we're given usually some paperwork, and it tells us how to manage ourselves. And sometimes we're just given the paperwork, and then we're sent home, and we don't understand the paperwork. We didn't remember to read the paperwork. So this is an example, for example, where a patient is discharged from the hospital or any medical care without understanding of their medication regime or the aftercare of the medical procedure. So as practitioners, we want to write clear written instructions, including scheduling follow-up calls to ensure compliance and understanding with people. So it's both on you and both on your doctor or doctors for this compliance. Okay, and then yes, as I wrote here at the last line here, the patient should research their medications and speak with the pharmacist if they don't understand them, and also the doctor. So that'll about conclude this presentation, and I suppose I want to just say at the end here is that it's very important that you take this information and, if you can, prevent illness whenever you can or offset it. So begin with a healthy diet, find out what that means for you, get the right labs done on a preventative basis and a regular schedule so you will find things going on earlier than late. Even I do my laboratory work every 4 to 6 months, and I am also astounded sometimes when I find an abnormality, because I think to myself in a moment, how could this be happening? It's me. I shouldn't be happening. But then I realize, of course, I'm a human being, and my body is going to show signs of something at some point, and sometimes those signs are on the labs before you feel anything. Thank you so much for your time and attention today, and I'll see you at the next podcast.